My name's Colin Ferguson. I'm one of the vascular surgery consultants in Morrison Hospital, and I also represent the Royal College of Surgeons as their Welsh representative. I've worked in Swansea now for 17 years, and I've also worked as a manager within ABM in the past, although that's not my current role. As a surgeon and as clinicians in general, I think we're very aware that things could be better and that the outcomes from the services that we're currently providing are in some ways very good, but in other aspects we could be improving. So that is the fundamental reason that we feel that there is a need for change, I think.
And what are the issues that are facing you when you deliver these services?
There are lots of issues. From the Royal College of Surgeons' perspective, one of the things that we're promoting at the moment is that we don't feel there's sufficient priority given to the services that are provided for emergency care. Recently there's been huge improvements in scheduled care, that is patients coming in for planned operations, and the waiting times for that has been greatly improved in the last 10 to 15 years as a result of the targets which were given to managers. But one of the costs of that has been that there's been a relatively lack of priority towards emergency care and urgent care. We feel very strongly there needs to be a rebalancing of that. The other aspect that we're very aware of at the moment is that there's a very strong relationship and increasing data becoming available within surgery for there being a relationship between the amount of work which is done in a unit and the quality of the outcomes, so that small units with perhaps single-handed surgeons are getting less good outcomes than larger units with several surgeons working together as a team. And that is one of the other main drivers for change at the moment. What I think we would like to see is change in the variation in outcomes. There are some units which are getting very good results, and there are some units, often the smaller units, which are getting less good results. And we need to see an equalisation of that and a bringing together of consultants into bigger groups in order that we can have governance of what's going on and making sure that all patients have access to the best outcomes, and that's our fundamental driver.